Welcome everyone to the BC Refugee Hub webinar titled Navigating the Medical Services Plan, or MSP, and the Interim Federal Health Program, or the IFHP, for refugee claimants. My name is Bahar Taheri, and I'm the project consultant with the BC Refugee Hub, and I'll be guiding us through today's session. I'm joining you from the unceded traditional territory of the Coquitlam First Nations, which lies within the shared territories of the Tsleil-Waututh, Musqueam, Katzie, Kakite, Squamish, and Stolo nations. It's important for me to acknowledge the lands that I'm privileged to work, live, and raise my children on as a way of showing respect and honoring Indigenous peoples of these lands. Acknowledgement for me is a simple way of resisting the erasure of Indigenous histories and working towards honoring and inviting the truth. ISSBC's BC Refugee Hub would like to gratefully acknowledge the funding for this project from the province of British Columbia through the Ministry of Post-Secondary Education and Future Skills. So what is the BC Refugee Hub? In November of 2015, with the arrival of Syrian refugee families and to assist and empower individuals and refugee serving organizations to help with the resettlement process, ISSBC partnered with the province of British Columbia and created this online resource hub called the BC Refugee Hub. The hub provides information about refugees that are arriving to British Columbia, the latest reports and publications, statistics, fact sheets, and a resource center. We also do online training sessions like this one. We also do in-person training sessions. And right now, our funding is more specifically focused on refugee claimants. One of the main resources that we released in last year, and we're continuing to update regularly, is the BC Safe Haven Service Directory. So this is updated quarterly with BC Safe Haven service provider programming and contact information for direct referrals. And this can be found on the BC Refugee Hub, and I'll share the link shortly in the chat box. We also have weekly and monthly activities. This includes our e-newsletter, our webinars, our training sessions, and we also update the website regularly. So I'd now like to pass it on to Kieran Davis, who's the program specialist with the BC Safe Haven Resource Network at AMSA.
Thank you, Bahar. I'm just going to offer a really quick land acknowledgement. As a provincial umbrella association, AMSA acknowledges that BC is on the unceded homelands of First Nations who have stewarded this land since time immemorial. We recognize the privilege that we have as settlers on this land and acknowledge that AMSA's operations are on the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. As an organization, AMSA is committed to creating a safe space for Indigenous voices. The Safe Haven program provides key supports to refugee claimants and other humanitarian and vulnerable newcomers. The Safe Haven Resource Network is a collaboration and partnership-focused program supporting direct service providers through targeted capacity building activities. This collaboration includes multiple partner organizations who play a key role creating resources for direct service providers. The BC Safe Haven Resource Network has 4 initiatives with different partners collaborating on each piece of the program. So the capacity building activities include webinars like this one, fact sheets, working groups, and many other resources, as well as supporting organizations to develop humanitarian movement response plans. Mental health related activities include in-person workshops, e-learnings, and information sessions, and a phone line for frontline service providers to receive support in their work. Language activities include consultation with lead Safe Haven contract organizations to create a curriculum and guidelines for Safe Haven language instruction. And our public support gathering arm is engaged through ACES, AMSA's charitable arm, in partnership with United Way BC to build community support for refugee claimants, including public awareness, donations, volunteering, and other community-based supports. Please connect with AMSA on LinkedIn, Facebook, and X, formerly Twitter, and visit our website at www.amsa.org for many resources, e-learnings, and recent reports. Thanks, and back to you, Bahar.
Thank you, Kieran. I will now pass it on to Katia Avalos, who's the Community Engagement Director with MAP BC.
Thanks, Sahar. Hi, everyone. It's nice to see so many familiar names on the participant list, but also a whole lot of new faces and names of people joining us from all over. My name is Katia Avalos. I'm the Community Engagement Director for MAP BC. And so the multi-agency partnership of BC is now a network of over 65 nonprofits, government and non-government organizations that work with and for refugee claimants in BC. We foster collaboration and partnership building in the refugee claimant sector to identify issues and work towards solutions. We also share relevant information on services, resources, and policy changes through our weekly news bulletins and email updates in the case of policy. We deliver virtual presentations in collaboration with legal experts on topics like the refugee claim process, the Safe Third Country Agreement, and pre-removal risk assessment applications, among others. We amplify the voices of refugee claimants through public engagement events like World Refugee Day, which we celebrate every June 20th, and that's coming up. So if you are somewhere in the Lower Mainland, mark your calendars for June 20th. It falls on a Friday this year. And we also have meetings that we do every fourth Thursday of the month to bring together all of our partners and service providers for networking discussion and presentations on refugee claimant topics. And I'm happy to announce that this month's meeting will be on May 22nd, and it will be our first virtual meeting. So that means that service providers from across the province will be able to join the meeting and benefit from all the information sharing and connections that happen. So hopefully you got, if you are on the MAP mailing list, you got the invitation to the MAP meeting. So please go ahead and register if you haven't done so already.
Okay, great. Katia and Kieran for your introductions. I will now introduce our speakers for today. So we have Kate Puckett, who's the Director of Beneficiary Services at the Ministry of Health with the province of British Columbia. And we also have Kamal Farmally, who is the program manager with Migration Health with Immigration, Refugees, and Citizenship Canada. We're also joined by Andrea Curry, who is the director of the IFHP program with Immigration, Refugees, and Citizenship Canada. So thank you all for joining us today and making time for our audience and presenting and answering questions. And Kate, I'll pass it over to you.
Great. Thank you, Bahar, and thank you everyone for joining us today. I want to start off acknowledging that I am joining with gratitude from the traditional and unceded territory of the Algonquin people of the Esquimalt and Songhees First Nation. I am joined today with a couple of my colleagues from the Ministry of Health, Dawn McLeod, who is one of our senior policy analysts, as well as Rachel Sheffield, who is our information analyst. I also just want to introduce Kamal, who has a few other people joining him from the Government of Canada. Kamal, did you want to introduce those with you today?
Hello, good afternoon, everybody. Yes, I'm Kamal Farmally, Program Manager with Interim Federal Health Program, joined with my director.
Hi, I'm Andrea Curry, the Director of the Interim Federal Health Program at Immigration, Refugees, and Citizenship Canada in Ottawa on the operations side of things. So supporting Kamal today. Nice to meet all of you. Thanks.
A quick overview of what we'll review as part of the MSP slides. We'll look at eligibility enrollment for MSP as well as coverage effective dates. We wanted to touch on eligibility for babies who are born in British Columbia, coverage for those who are refugees or claimants, as well as the requirements for maintaining MSP coverage. As part of this slide deck, we've also provided some reference material as well as a contact email for my branch within the province of BC or the government of BC, should you have any case-specific questions that we can't answer today. Kamal, I'll just turn it over to you to go over what you will be covering from the IFHP side.
Thank you, Kate. I'll be just going over our presentation, one-on-one IFHP presentation. That will also answer some of the questions of the participants that they may have to introduce the program. And of course, we'll take the questions after. So I'll be going to the eligibility, the program administration, and then the IFHP itself and what's covered on the IFHP.
Very high level overview. And I will be using MSP as an acronym for Medical Services Plan throughout the rest of this presentation. So to be eligible for MSP, an individual must meet the definition of a resident that's defined under the Medicare protection. And a resident must be either a citizen of Canada or lawfully admitted to Canada for PR, make their home in British Columbia, and is physically present in the province for 6 months in a calendar year or a shorter time as prescribed by our regulation. Excluded and specifically excluded from this definition are those who are in British Columbia as tourist visitors. The Medical and Healthcare Services Regulation, Section 2 of that regulation, broadens the definition of resident to include those who are deemed residents. Deemed residents include an international student or a work permit holder, both with permits 6 months or longer, a diplomat, a spouse, or a child of a resident who is going through the process of applying for permanent residence, a child adopted by a resident or a child born to a resident, accompanying spouse or child of a deemed resident. And all of that list, individuals must continue to meet B and C of the definition within the meaning. They make their home here in British Columbia and are physically present for 6 months of the calendar year. In order to enroll in MSP, most individuals must complete a 2-step process. The first step is to submit a BC application for health and drug coverage. Now, this application form was enhanced a number of years ago to include the application for fair pharmacare and supplementary benefits on the same form as MSP. But within that application form, an individual must also include their foundation document. For a Canadian citizen, this might be your birth certificate, or individuals that arrive with as a refugee, this might be your copper or your e-copper. For individuals who are Canadian citizens or PR, they must also complete a second step of attending an ICBC driver's licensing offices where they take their primary and secondary ID, have their picture taken, and obtain a photo BC services card. So children and temporary document holders don't need to complete the second step. They only need to submit the BC application for health and drug coverage, and they would be issued a non-photo BC services card. So for individuals who have a confirmation of PR document and they're waiting for IRCC to issue their card, that card would be required as the primary document for completing that second step. We do have a process in place where we can enroll an individual with temporary coverage until such time as they can complete that second step of enrollment. Looking at MSP coverage effective dates, meaning when does MSP start? For most new and returning residents, they are required to fill a wait period before MSP will start. This wait period consists of the balance of the month in which residency is established or reestablished, plus 2 months. So Kate Puckett could arrive in British Columbia on May 13th. My wait period would be the remainder of May, June, July, and my coverage effective date would be August 1st. However, there are groups that are excluded from serving the wait period, and this does include those who arrive with what we use in terms of policy as convention refugee status. And more recently, this includes individuals who are, or children who are born in BC to refugee claimant parents who are covered by the Interim Federal Health Program. One other piece that we wanted to include in this slide is for individuals who move from another province. So in accordance with the portability provisions within an agreement on eligibility and portability between the provinces, if an individual comes to BC or permanently moves to BC from another province, their province of origin continues to provide coverage for the MSP coverage wait period to ensure that ongoing coverage until MSP is effective. I think it's also to point out, or it's important to point out, that a child born in British Columbia is a Canadian citizen and may be entitled to MSP, but really the timing of the MSP coverage will depend on the circumstances of their birth. I think we've outlined beforehand children born in BC to residents of BC, that newborns coverage is effective as of their date of birth. The same is true for children born in BC to refugee claimants with IFHP coverage. They have coverage as of their date of birth, as well as those who are born to those convention refugees in British Columbia. The only children that do serve a wait period are newborns born in British Columbia to non-residents of BC, meaning that neither parent is eligible for MSP, and both either have a visitor record or is here as a tourist, or their status may be unknown. For refugees and claimants, here's some information on MSP. If an individual arrives in Canada holding convention refugee status, they are eligible for MSP enrollment. They must apply for MSP using the BC application for health and drug coverage, and they are eligible as of the day of their arrival. In this case as well, individuals are provided access to the supplementary benefit program for their first 12 months until such time as they can file taxes and are eligible through other means. Claimants for convention refugee status after arrival in Canada are generally eligible for coverage under IFHP, something that Kamal will talk about in just a minute, until such time as they're eligible for provincial or territorial coverage. Refugee claimants who also hold a work or study permit valid for 6 months or longer may be eligible for MSP enrollment. In this case, MSP is effective after serving the wait period, and it is in place until the end of the month in which the permit expires. For convention refugees provided status after arrival in Canada, they're eligible for enrollment again after completion of the wait period. To determine that their eligibility, again, they would have to complete the BC application for health and drug coverage and provide a copy of the confirmation letter issued by the Immigration and Refugee Board. And the date of the letter indicates the day that the individual was provided with convention refugee status. As outlined in the introduction, here is a slide for some extra information should you require it. We've also provided the email address that comes to my branch, particularly if you have any case-specific questions that you need to look into, and we can answer you back via email. Alternatively, Health Insurance BC administers MSP on behalf of the province. There is a phone number as well as an email address here, just noting that they can only provide general information via email. So I would suggest that if you do have case-specific questions, that you either call the toll-free number or email the Beneficiary and Diagnostic Services branch directly so we can help answer your questions. With that, I will transition over to Kamal, who will give an outline and discuss the Interim Federal Health Program. Kamal, over to you.
Thank you, Kate. I'm just going through the overview of the Interim Federal Health Program. So basically, MHP, or Migration Health Branch, is the Government of Canada's Centre for Managing Health-related aspects of migration. Its key roles include leading migration health policies, programs, and managing medical services for refugees and asylum claimants. MHP bridges immigration and public health by integrating medical screening, health policy, and service delivery to support and protect public health. And MHP's expertise include medical doctors, nurses, and other professionals, and it operates both nationally and internationally with a network in Ottawa, London, Delhi, and Manila. And IFHP, well, basically, core MHP's core programs are IFHP that provides temporary health care coverage for refugee and asylum seekers. Medical surveillance and notification that is monitoring health conditions like tuberculosis and HIV, etc. And also health screening that ensures new migrants don't bring infectious diseases into Canada. So I'm just going to go now further into IFHP. So basically, IFHP provides limited temporary health coverage for those not yet eligible for provincial territorial health insurance. It also provides pre-departure services, such as medical exams for refugees destined for Canada. So the IFHP provides temporary health coverage for eligible individuals until they qualify for provincial or territorial coverage, but it does not cover Canadian citizens, ineligible foreign nationals, or dependents who do not meet eligibility criteria themselves. It excludes temporary visitors, does not offer pre-departure services, does not coordinate or share costs with other insurance plans, and does not cover services claimable under other public or private plans. So it has two components. One is in Canada coverage that resembles to basic health services provided by provincial health insurance, but are temporary, of course. And then pre-departure coverage that includes medical exams, vaccination, and support during transit. And IFHP eligible group includes resettled refugees, asylum claimants, and other vulnerable groups. And once again, it does not cover Canadian citizens or foreign nationals, not specified as eligible. So then we have eligible beneficiaries and length of coverage. So for the eligible beneficiaries, we have resettled refugees that include government-assisted refugees that we call also GARs, blended visa office referrals, privately sponsored refugees, joint assistance program, sponsorship, joint, which we call this also JAS. They're covered overseas for IMEs, that's immigration medical exams, follow-up treatment, certain vaccination, medical support in transit, or any outbreak management. And the other groups that we have, refugee claimants, they're not, or refugee claimants awaiting IRB decisions, or any ineligible claimants eligible for PRA. So there's no overseas coverage for them. And then for in Canada coverage, for the resettled refugees, they're qualified for basic, which is the benefit until the beneficiary qualifies for provincial or territorial health insurance, usually up to 3 months, and supplemental and prescription drug, that is the beneficiaries receive income support from the Resettlement Assistance Program or its equivalent in Quebec until the beneficiary is no longer under private sponsorship for 12 months. So this also usually for 12 months of period. And then for the next group, which is refugee claimants, of course, they are not covered for overseas coverage, but they are covered for in Canada coverage until the beneficiary leaves Canada or become eligible for provincial or territorial health insurance. And so we have also the other eligible group are protected persons in Canada that are covered for basic and supplemental and prescription drug, which is 90 days from the date the asylum claim or the PRA pre-removal risk assessment is accepted, or until they become eligible for provincial territorial health insurance. And the next eligible beneficiaries are victims of human trafficking that are covered for basic and supplemental prescription drug. And the duration of the temporary risk, it's basically the eligibility or the length of coverage is the duration of the temporary resident permit. So I'm just going to the next slide. Group not covered by the IFHP. So the following individuals, like basically, are not covered or are not eligible for IFHP coverage. That includes Canadian citizens, foreign nationals outside eligible groups, certain dependents, Canadian citizen born children of IFHP beneficiaries, for example, refugee claimants who withdraw or abandon their claim, those found ineligible or redetermined ineligible for referral to the IRB without pro-eligibility, and individuals covered by a provincial or territorial health plan. So examples of IFHP benefits in Canada, we have, they're covered for medical services, such as a doctor's visit, psychiatrist services, etc., hospital services, emergency room visits, hospital stays, medical or surgical care, emergency medical transportation, ambulance services, for example, and also limited vision care, urgent dental care, emergency dental exams, dental x-rays, extractions, dentures, as well as mental health services, psychotherapy counseling and psychology counseling, and as well as assistive devices, medical supplies and equipment, home care and long-term care, occupational therapists, etc. IRCC is responsible for developing national IFHP policies, operational guidelines, and confirming clients' coverage at ports of entry or in land offices. IFHP oversees program administration with the claim administrator, Medivie Blue Cross. The claim administrator handles provider registration, invoice verification, claims processing, and serve as the main point of contact for IFHP inquiries while maintaining a public list of registered providers. Public and private service providers must be licensed, registered with the claim administrator, confirm client eligibility, deliver services, and submit claims for reimbursement. And also in Canada, IFHP process, the way it works is that eligible clients are issued IFHP certificate documents or document by CBSA or IRCC officers. And IRCC provides an online list that beneficiaries can use to search for an IFHP provider and to use the services of, for example, hospitals, doctors, pharmacists, etc. The beneficiaries has to show their proof of coverage to the provider. And the IFHP service provider bills the third-party claim administrator, again, Medivie Blue Cross, for services rendered to the beneficiary. And IRCC reimburses the third-party claim administrator for the bills submitted by the IFHP registered provider. And it's important to note that IRCC does not reimburse clients directly. Clients do not pay for the services upfront, and IRCC does not issue payment to provinces, territories, and IFHP is a separate parallel health insurance scheme to provincial coverage. And claim administration effective March 2022, the new contract, okay, that's a contract with Medivie Blue Cross, who is now the claim administrator. So that concludes today's presentation.
Okay, thank you, Kamal and Kate. Thank you so much, everyone, for joining us. I also want to thank Katia from MAP BC, who I collaborate with often on these webinars to make sure that they are timely and are what frontline workers who work with refugee claimants are looking for. So thank you, Katia. And also thank you to Kieran for providing us with an introduction. Thanks, everyone. Thank you for all your work with refugee claimants. Have a good afternoon.
Thank you for organizing everything too, and thanks for everyone attending today.
Thank you, Kate.
Thank you, everyone.
Okay, bye, Kamal. Thank you.
Bye.
Bye.